Well, hello and welcome to my fellow Idahoans. This is Jim Thomas, the producer, and I'll be the host today, today's edition of My Fellow Idahoans. Now, we've got a great show for you today. I've got a very special guest coming up here shortly. But first, I want to show you my favorite books. If you haven't read these, it's definitely worth it. There is The Law by Frederick Bastiat. He was a French political philosopher, educator in the 1800s. In 1850, he wrote this little book. And the basic concept behind his advice on what you allow and not allow government to do is captured in this concept. Life, liberty, property do not exist because man has made laws. On the contrary, it was the fact that life, liberty, and property existed beforehand that caused men to make laws in the first place. So Frederick Bastiat was a very interesting chap, had a lot of good advice that unfortunately, in my most humble opinion, our government for the past 100 years has been breaking all the rules, all the advice given to us by Frederick Bastiat, and that is indeed the cause of many of our problems. So buy the book. It's available at bookstores and so forth, and it's 160 years old, and it is still good. The other book is kind of under the heading of Know the Enemy. The enemy. Socialism, communism, whatever you want to call it. The enemy of freedom. Know the Enemy. Get this book, Rules for Radicals. Again, it's still available. Voila, here's a copy. Written by a despicable Chicago community organizer back in the day. And he wrote this book to kind of tell radicals. It's called Rules for Radicals, written by Saul Alinsky. And he tells radicals, quit killing people and breaking things. If you want to bring down this country, get elected. Get cleaned up. Lie, cheat, and steal to get elected. Just get those current people out of power, and then we can create a wonderful America. Just a short comment on current events. Boise City Council and the mainstream media here in Boise. Just a short message. We are the United States of America, as you well know, and I understand that you are pushing for raises. And the reason, justification, is that 6 years have gone by and you haven't had a raise. Well, in the United States, that's no justification for a raise. In the United States, we're governed by the free market. That's what's made America great. The free market means what it means. Are we teaching this in high school these days? The free market means that supply and demand determine prices and wages. Supply of people that might be willing to be governor, and the demand. Well, the demand, we need one mayor, we need one mayor at a time. And I think there's quite a few people that would love to serve as mayor at the current salary, 90 whatever thousand. Well, Mr. Beater and City Council, if you need more money than 90,000 a year, then again, this is the United States, the non-discriminatory United States of America. There's no upper limit to the age, I don't think. There's an upper limit to the age where you can attend college and you can go qualify yourself for a position at a higher salary. To our mainstream media, you know, you might question just a little bit and say, well, 6 years, yeah, so what? Why do you need more money? If you need more money, why not do something else that pays more money and let somebody else be mayor? Why don't we ask those kind of questions anymore? I think we used to, didn't we? So here's a little bit of wisdom. This Aesop's fable is called The Farmer and the Cranes. Cranes is in the bird. Some cranes made their feeding grounds on some plowlands newly sown with wheat. For a long time the farmer, brandishing an empty sling, chased them away by the terror he inspired. But when the birds found that the sling was only swung in the air, they ceased to take any notice of it, and they would not move. The farmer, on seeing this, charged his sling with stones, and he killed a great number. The remaining birds at once forsook his fields, crying to each other, "It's time for us to be off to Lilliput, for this man is no longer content to scare us, but begins to show us in earnest what he can do. The moral of the story, if words suffice not, blows must follow. You know, and this kind of reminds me of training my little dog that I love dearly. Got a little min pin. I suppose this goes with any dog, really. Yeah, they sort of learn your point of action. You know, you can yell, you can do whatever to these fine animals, but they don't learn what you want until you sort of hand place them gently, carefully, but you do use a little bit of force and you hand place them. So when you say sit and they just look at you, you kind of hand place them in a sitting position and reward them. And yeah, so this is sort of on the negative side, this Aesop's fable. If words suffice not, blows must follow. And let's say action must follow. Well, with that, we'll get into our show for today. I have a very, very special guest with me today. His name is Stephen Ackerman. Well, Steve Ackerman, welcome to My Fellow Idahoans.
Thank you, Jim. Thank you for having me.
It's a pleasure to have you back.
Thank you.
We're going to talk about Medicaid. Now, Medicaid, not Medicare, Medicaid, is that correct?
Yes.
And this is really interesting. Our off-camera discussion is extremely enlightening. And I know you folks out there are going to be really, really interested in what Steve has to share with you today. Well, Steve, would you please define for everybody Medicaid? What is it?
Certainly. Medicaid is a public health program designed for people below age 65, and it essentially covers folks who are low-income adults who also have some kind of other qualifier. So it may be a woman who is pregnant, so a low-income adult female who's pregnant. It may be a single mother, single father, or a married couple, low income with children, or it may be a low-income adult who has a disability. So you have to have that qualifier. It's not simply low income, it's low income plus some qualifiers generally. Generally it qualifies you for Medicaid.
Okay, now Medicaid is addressed under the Patient Protection and Affordable Care Act.
Yes.
Some people just call it the Affordable Care Act. Some people, well, I won't mention the other name. At any rate, so you mentioned the qualifications for Medicaid. Now, this new health care, the Affordable Care Act, what changes are we anticipating?
Yes, essentially the Affordable Care Act is going to get rid of all those qualifiers, the requirement, if you will, that you're pregnant, that you have children, or that you have a disability. It essentially says if you make up to what they call, we have a thing called the federal poverty level. Okay, it's right about $11,000 a year, and it's put out by the Department of Health and Human Services. If you make 133% of the federal poverty level, a little higher, or below, you qualify. It doesn't matter if you have children, it doesn't matter if you're pregnant, it doesn't matter if you have a disability. So it would be every adult under age 65 would automatically qualify. That's essentially the change.
So with the Affordable Care Act, eliminating all the qualifiers, it's for low-income people under 65. So people that are above that poverty level, what the Affordable Care Act requires us to go buy insurance. Is that correct?
Yes, and what they do is they say if you're above that 133% of the federal poverty level, or up to, I believe it's 250%, you qualify for various tax credits, basically to help pay for the premium. That's essentially what it's trying to do. It's saying you have to, because we are taxed or penalized. That's been a bit of a tricky word there. The administration has changed. They argued penalty, then they went in front of the Supreme Court and said, actually, we mean tax. So they will tax you if you don't buy health insurance that meets a certain definition laid out by Congress. It's all in the Act. So those people that are making more than that and would not qualify for Medicaid, they're basically told you must go buy health insurance that fits a certain definition, and you'll get some tax credits to do it, and you have to buy it through an exchange, and etc. There's a lot of process steps.
Okay, so the bottom line is, it sounds like everybody has insurance or some pay the tax.
That's right. That's right.
So Medicaid covers everybody that's below that income level
That's right.
because they can't afford it.
Yeah.
You know, so they're covered,
Yes.
but somebody's paying.
Yes.
Now, what's the economic impact here?
Yeah. Right now, the federal government pays 70% of all Idaho Medicaid recipients, and Idaho pays 30%. The federal government is arguing, telling Idaho, or they're asking Idaho, they're saying, if you expand the number of people that would go on Medicaid because of our new, getting rid of all these qualifiers, if you expand that roll of about 100,000, right, a little more than 100,000, if you add those people on, we, the federal government, will pay 100% of the Medicaid costs of all the new enrollees. And then they work it down to 90% over through 2020. But basically, they're telling Idaho, they're promising Idaho that down the road they're going to pay anywhere from 90 to 100% of all the new of the Medicaid, the new Medicaid enrollees.
So it sounds like there's going to be a lot more money thrown at the medical industry.
Yes.
I mean, is that true?
Yes. Yeah, there would be, because you would have more people that would be getting prescriptions, more people going to the hospital, more people. Yes. So the answer is yes.
So some of those people aren't getting medications right now.
Correct.
Right now. So they're somehow living. They're getting by without the meds.
Yeah.
They're getting by without an annual exam. Physical exam.
Yeah, and there's going to be more services that they're able to get too, because that's the other thing is it's not simply insurance. Medicaid will have to have all these new services, so people will be using more services because they're going to be made available, and the federal government again is promising we'll pay for that. So they're telling Idaho, they're saying, please go ahead and add the people on, and we'll pay all those new costs.
So with federal money.
Yes.
And then federal money, if I'm not mistaken, is a little shaky these days.
Yeah, that's a worry, and that's something you and I have talked about before. And we've talked about the ramifications. My worry is given the fiscal problems in Washington D.C. Is will they able to fulfill that promise?
Oh, the promise that they're going to pay.
The promise that they're going to pay.
So you're even questioning whether or not they're going to fulfill that promise. Well,
I'm questioning it, and I'm questioning it for one big reason. Congress can come back next year and simply pass a law that says, kind of given our current fiscal situation, we can't pay that 100% and down to 90%. We can't pay that 90% of the new enrollees. We're going to have to make a new number, and let's say 60% or 70%, because we have other obligations. Right now, if they don't come up with some kind of workaround, entitlements are supposed to take a 10% cut. So I'm not sure how they can promise to spend more money in the future if they're currently going to have to undergo some cuts. So I would worry. If I were in the State House, I would worry, because what are the options for Idaho? The options are, we pay more out of our own pockets for these new enrollees, which means people that are now paying taxes, they're going to have to pay more.
Pay even more, all right, okay.
The other is money will have to come from education, prisons, the other things that state does. They're just going to have to shift more money over to Medicaid. Or, I think the worst, and frankly most cruel, is we promise people that we'll cover them, and then a few years down the road, we have to stop covering them. And I think that's very cruel to do.
No money, sorry.
Yeah. I think that's the worst of all. Because there's a lot of good people here who are, people are in between, maybe in between jobs. They're in a part-time job. Idaho's filled with small businesses. Businesses that have 9 or less employees. It's a huge part of our economy. And they can't afford big health insurance policies.
Okay. So now let's see, the number of people in Idaho that are currently on Medicaid is, what, how many?
It's about 240,000, 235, 240,000.
So it's not quite a double. They're saying about maybe, so another 100.
Yeah, about 100.
40% more, let's say.
Yeah, it's about that. Yeah, it's about 40% more.
Increase.
Yeah. You've got some people who are currently qualify for Medicaid, but they either don't know about it, or they simply have chosen not to do it. Some people won't do it. Yeah. Either don't bother, or they don't want to because they feel guilty. They just don't want to do it. So they will say, I won't do it. But at some point, they may kind of be pulled into that. And so I think it's gonna be at least 100,000, maybe a little more. You're gonna have a few more people jump on.
Yeah, so if these low income folks,
Right.
if they're sort of healthy right now, that's probably the last thing on their minds is going and seeing a doctor.
Good point.
And then all of a sudden, they get that abdominal pain, right?
Right.
Or they get that headache, or
Right. Yeah.
So
Right.
And then they run. What do? They go to the emergency room, I would imagine.
Yeah, and
I mean,
federal
that's
law.
what I would do.
Yeah, and federal law requires that they have some care.
Well, yeah,
they be
that's
given
the
some
whole
care,
deal
and then,
there.
Yes.
And so they come back, and then at that point, I guess the hospitals would say, well, right now, today, before this expansion. But even if a person low income, where they do qualify, they just don't know it, haven't paid any attention to it, no reason to.
Right.
Now they have a reason to, and the hospital
Yes.
might sort of say, hey, do you think you qualify for Medicaid?
Yes.
And, anyway, so when they do that, then then they help them fill out the paperwork and whatever, and get signed up for
Yes.
Medicaid.
That's right. That's
as
right.
It is right now.
Yeah.
Yeah. So do you happen to have a cost that we're paying these days? Idaho's paying for Medicaid.
Yeah. The total cost is about 1.9 billion. And
B word, right?
B.
Billion.
Yeah, with a B.
1.0. So almost
Yeah.
$2 billion a year total.
And we're paying about 30% of it.
So
maybe a little more.
So
roughly. You have some admin costs. Some of that.
$600 million.
Yeah.
So Idaho is paying $600 million.
Yeah.
For Medicaid today.
Today.
And we're talking about increasing that by at least 40%.
Yes.
But there's a lot of people who, when they find out, oh, hey, this is a good deal, you no longer have these qualifiers.
Yes.
And
Yes.
so go get a physical.
Yes.
So that
right.
that expenditure is probably going to go up more than 40%.
Yep.
For
That's a safe
Idaho and
assumption.
Idaho taxpayers.
Yeah.
Now, is this tax money coming out of Idaho's income tax or?
I believe
property?
I believe it's general fund. So I think that would, the answer would be yes, income tax. Yeah. And I think and one of the arguments that there's some arguments out there that by actually doing this expansion, you're going to have some savings, and people will make the argument, well, there's catastrophic health. But we do have that CAT fund, right? The Catastrophic Health Program, and one of the differences between it and Medicaid is actually very important, and that is the CAT fund can actually put a lien against property if a person doesn't pay. So if a person simply gets a certain amount of care and they choose not to pay, they just ignore hospital bills completely, they are allowed to lien some property, and that at a minimum incentivizes somebody to maybe set up a payment system, right? So that's gonna capture some of that. Medicaid can't do that.
Yeah.
So that's just one of the problems with arguing you'll have this much in savings. I mean, there is some savings that could come, but I think it's being overwhelmed by the cost, in my view.
There's an acquaintance, a young gal. She's a server. They used to call them waitresses, but I guess food server. Is that what they call them now?
Sure, yeah.
Anyways, we have to be
keep
careful.
caught up on that.
Be careful here.
That's right.
Anyway, well, all right. So she's a food server. Does a good job, and she was out. She's like in her mid-20s, 25, 26, something. And she was out having fun, dirt biking or something, and had a pretty serious fall. And they rushed her unconscious, rushed her to the hospital, ER. At one point she had a tube from her brain that went down next to her spine, yada yada, to drain the fluid off of her brain.
Yes.
And the bottom line is she ran up a modest bill, and she had no health insurance. 26 years old, food service,
Right.
healthy.
I'm healthy. I'm
exercises,
never needed. Yes.
Take my vitamins.
Right.
Well, so she gets a bill for $40,000.
Right.
And then they call her, the hospital. Hey, when are you going to start? You got to pay this. And she said, "Well, hey, I'm a food server. I'll pay you what I can, like so many dollars out of her tips a week, kind of thing." But she said, "Oh yeah, I get called. They call me all the time." Well, the reason I raise this point is that the hospitals, there's more than one person that fits that category.
Yes.
Young or maybe not quite so young, not much money, no assets to speak of.
Right.
Very
little savings.
Accident, a catastrophic accident.
Yes.
ER, and when she finally comes to, she owes $40,000. And prior to that, she was just riding her bike. Now all of a sudden, she's got a $40,000 bill.
Yes. Yes.
All right. So now with the Affordable Care Act,
right,
she'll be covered one way or the other. Right.
Yes.
She'll be covered either via Medicaid.
Right.
If she's really
provided she meets that income
level.
Yeah, the 130.
Depending on how much she works and what her tips are.
Mm-hmm.
Or she will be buying her own health insurance.
Right.
Or paying the tax. Now, if she pays the Affordable Care Act tax,
yes,
is she covered?
Now,
that's an interesting. I never thought of this before.
It is. It is. Because she's paying the tax for failing to have the coverage. That's right. The other thing is the tax could be imposed upon her employer. So this tax is not simply for individuals. It's also an employer tax. So, and again, depending on the size of the employer, in other words, depending on the number of employees, the employer could. So it's either the individual that's taxed for not getting the insurance, or it's the employer. And so the answer is going to be that she is going to be required to have to pay much more of her income toward insurance. And if she doesn't, she'll pay the tax. Now, if she pays the tax, that is a good question as to whether she'll have to then get insurance. I am not sure.
Or whether or not she's insured, period.
Right. And if her tax penalty is lower than the premium cost of her insurance, wouldn't she be better off just not buying insurance?
Yeah, and then vice versa.
Right, and then what happens? She goes to the ER, and all the same things that happen now that happened before, except one difference. Now she's poorer than she was before the Affordable Care Act. So the little bit of money she could have paid the hospital has now gone to the federal government to cover costs that they are claiming, to cover. So that's a problem, I would argue.
Yeah, very interesting.
I think the hospital ought to get it before. And part of the reason it's $40,000 is because we have government rules that limit the number of medications that are available, the choice of medications, so the medications are more expensive, and hospitals have to buy the medications. It's things like that too that don't get brought up, but are there.
Okay, so just to kind of finish up with her that case, if you will. So a low-income person, maybe right above that poverty level, let's say.
Yes.
And so required to buy the insurance. And so let's say she buys the insurance, and then she goes and has her accident.
Yes.
And then she goes to the hospital, $40,000, and the $40,000 is covered by the insurance company.
Yeah, a lot of those costs shift over to the private insurers. So that would be people that have insurance.
Because she has insurance, she went ahead and bought it.
Oh, yes.
So then the insurance company picks it up.
That's right. They would pick it up.
There might be some little bit, where you have to pay the first to 10%, or they do a little bit of that in the insurance industry right now. I'm assuming that'll kind of stay.
Yeah, all insurance companies do that.
Yeah. So, what's interesting now, if you say, okay, there's X number of people who do this kind of thing, who aren't insured, who are young, who have a catastrophic event, and who don't have any assets to go claim. So the hospitals now are sitting there with this huge debt owed to them.
That's right.
And a big advantage to the hospitals might be they're going to get money. They're not going to have a whole bunch of these every year, or however many,
Yeah.
That might be an interesting reason why a hospital would be somewhat leaning toward, favoring this Affordable Care Act.
That's a good point. Yeah, that's a good point.
Just a thought. I don't know.
I think what's interesting, that is a good point, and I think what's interesting out of this is, if our woman here decides, if she decides to pay the tax, and therefore foregoes getting insurance, if she ends up never getting insurance, we keep going back to the same thing. She's still that person who doesn't make a lot of money, who has no assets or few assets, few savings, is still showing up to the hospital, but yet she's even poorer because some of that tax money's already gone.
Yeah, she's paid the tax.
And that's because the Affordable Care Act doesn't allow you to buy any insurance. It must be insurance that fits the definition they say.
I see.
That's the problem. If she could buy a cheap insurance, think about a person who's a poor driver who has caused a couple of accidents. They can still buy car insurance. It's not as good. They may not have full-blown coverage. They may have kind of some limited coverage, but guess what? They have some coverage, and they're out there on the road next to you and I and everybody else with some kind of insurance. Maybe not great, but something's better than nothing.
Yes.
And in this case, we're not answering that.
Amen. Other concerns with expansion. What other concerns do you have? We have just maybe a minute and a half now.
Okay.
I know that's not very much time.
No, not at all. Not at all. I mean, there's several areas. I guess one thing I would say that is a cost, it's not a monetary cost, but that is, Medicaid tends to pay, say, 60% of what private insurance pays to doctors. So there are fewer doctors that take Medicaid. If you expand the number of enrollees and you still keep that small pool of doctors that accept Medicaid, you're going to have longer lines. You're going to be taxing the doctors and nurses, etc., with filled waiting rooms, etc. So that's a cost. If I have to go to a clinic, if I'm working and I don't get paid for my time off of work, and I have to spend 4 hours in a waiting room as opposed to 1 hour, that's 3 hours I could have earned money. So I would argue the working poor are hurt most by this. And after all, that's what the free market has a lot of alternatives that you and I have talked about, and it's really for the working poor. And it shows that the free market is really the more compassionate way to go. I'm not seeing a lot of compassionate here. With the government.
An economist recently reported something along the same lines, that the working poor and even the non-working poor,
Right.
but especially the working poor, they are much better off in an absolute free market, small government.
Yeah.
Less reliability on government. That the working poor really are much better off than under a sort of a socialist, if we will, kind of government takes care of everything, and they promise all this stuff for the poor.
Yes.
They really hurt the poor, is what we're saying. Well, very good. I hear a little chime in the back. Steve, it's been a pleasure. Steve Ackerman, I should say.
Thank you.
In having you on My Fellow Idahoans again.
Thank you.
And very instructive as to what's going on with Medicaid. I didn't realize so much money was involved. Very interesting. Thank you again for being on My Fellow Idahoans.
Thank you.